Let's imagine who this patient is and see if we can work out what's the right thing to do for them. So the first case, let's imagine you are doing an ECG. Let's say the medical professional is busy. As we know, NHS and other services are very stretched. So you've got a 75-year-old in front of you. She says, oh, had a bit of a shortness of breath. I'm feeling a bit of a cough. She comes in with a high temperature and she's been feeling her heart racing quite fast. She's got history, she mentions, of high blood pressure, a bit of cholesterol, and otherwise just had a knee replacement done 10 years ago. She's on blood pressure medication, amlodipine, and a cholesterol medication called statin. She mentioned, oh, I used to smoke. Oh, no, sorry, I'm a non-smoker. Does not drink alcohol, is independent. Let's say you've got a stethoscope in front of you. You listen to some crackles. The observations very kindly have been input. She's got blood pressure 94/59, pulse of 120, respiratory rate 24, SATs of 89 on air, and temperature 37.5. What would you do next? And I think someone's brilliantly written out to give oxygen. Excellent. So you've correctly looked at that this needs correcting. Good. So now we are correcting this. Anything else you would like to do? Repeat SATs. Excellent. And that's a great answer. Yeah, so we will put the SATs on and recheck it. And anything else which is abnormal here? Bloods, excellent. So what I would suggest, you are absolutely right. Bloods are essential. But what I would suggest also, VBG, excellent. Why? You are absolutely right. What thing are you looking for in a VBG?
I'd like to do like a venous one to actually see
Yes.
what the actual oxygenation is.
Okay. Yeah,
like cells.
You're right, and I think it gives you're absolutely right. I think that's an excellent answer. It gives a great idea, venous blood gas, of what the patient's status is. And you absolutely, this is probably the quickest blood test to tell us how unwell the patient is. Sending off the routine bloods are essential. They will help guide treatment, but they will take about, let's say, half an hour, 2 hours, sometimes 4 hours for them to come back. But the venous gas straight away will tell us how unwell the patient is. So venous gas will give us an idea of what the pH is, how acidotic they are. They'll also tell us what the lactate is. And lactate is important because if someone is septic, that lactate could be significantly elevated, telling us they're septic, dehydrated. They may not give us that careful information on oxygenation because it's from the vein, but they can give us some clues. The other thing is this blood pressure normal with that heart rate? Is that low, high? Is that low or high? So is the blood pressure normal, low or high?
Blood pressure low, heart rate high.
Excellent, brilliant. So now we worked out this patient looks unwell. I think we worked out together the blood pressure is low, heart rate's high. I'll mention the respiratory rate's high because aim for around 16 and the saturations are low with the temperature. So this someone shows early signs of sepsis. And pneumonia, chest expansion, excellent. I think whoever's put down, that's a brilliant diagnosis. I think we've already got the presumption and a preliminary diagnosis. Blood is sent off, they'll take 4 hours to come back, so we can't really rely on that. We've got a gas, let's say venous gas shows the VBG lactate of, let's say, 4. Lactate of 4 is elevated, giving an indication of sepsis. So now, very helpfully, someone's got an ECG, and this is the ECG. Would anyone like, we can work together, would anyone like to comment on anything about the ECG? So what I can help is, firstly, it's a fast heart rate. It's going at a rate of over 100. And is it regular or irregular? Any thoughts, regular or irregular?
Irregular.
Excellent. You're absolutely correct. This is irregular. And what I would suggest is sometimes it can be quite difficult because when we've got a paper in front of us, you're like, is it right? Am I making things up? What you can do is put a piece of paper, blank piece of paper, and draw 3 lines. 1, 2, 3. Move that piece of paper across anywhere. If they do not fit in, that means irregular. You're absolutely right. So it's an irregular heart rhythm. What is the most common irregular heart rhythm that we can think of? It's called atrial something.
Atrial fibrillation.
Excellent, excellent. You are absolutely right. So now we'll go back. So this is I think we work together. We've got the correct diagnosis. So now I'll just show you over here. because we've got an irregular heart rhythm with an atrial fibrillation. And absolutely correct, oxygen was a correct thing to do. And the reason I put this in here, because we cannot ignore the patient. We have to treat them as a whole. Even though we've got the diagnosis here, we've got to treat them. Oxygen, probably antibiotics, early sepsis protocol, and fluids as well. That if these are, even though you may not do it, you escalate and say, and I think whoever you speak to, they'll be incredibly impressed. You think, whoever physician is, doctor, nurse practitioner is, I think he needs fluids. I think she needs fluids, sorry. She needs antibiotics and oxygen. If that is done, you've provided that patient with brilliant healthcare.